Britain has promised to start testing more people for the coronavirus. It's targeting 25,000 tests daily by the middle of the month, double the current number. Anger against the low testing rates is growing after the death toll rose sharply to 1,789. A 13-year-old boy with no underlying health issues is among the latest fatalities. Britain's housing minister says the next couple of weeks will be critical. Ollie Barrett joins us live from London for more on this. Ollie, why is the testing rate still so low in Britain?
Well, the government has a couple of explanations. It says that it's had trouble getting its hands on some of the chemicals that are required for some of these tests. It's had trouble getting its hands as well on some of the equipment required for more widespread testing. It also says that actually the capacity for testing is bigger than the National Health Service is currently making use of. So it is instructing NHS trusts up and down the country and hospitals as well to do more testing, particularly of NHS frontline staff. But the government is facing criticism for this from all sides at the moment. Some critics are saying the government's simply unable to get its hands on enough tests at the moment because it was ill prepared for this outbreak, that it should have been buying more testing equipment and chemicals earlier when it became clear that there was an outbreak of the coronavirus, COVID-19, moving around the world. There is certainly a problem with supply globally at the moment. Of course, dozens and dozens of countries are trying to get their hands on as many tests as possible. The UK is just one of those countries, and there is a real problem with supply as a result. But huge criticism for the government for not ramping up testing as quickly as it said it wanted to itself. The government has not been meeting its own testing targets.
Ollie, meanwhile, the daily death toll in the UK has spiked in recent days, and the government is now warning that things are going to get worse before they get better, even as the NHS medical director says that there are some green shoots of progress.
Yeah, this is all to do with the time lag that we see in terms of putting in social distancing, safe distancing measures and then seeing the results from them. We are seeing the death rate spike in the last 24 hours here in the UK quite dramatically, the biggest 24-hour rise we have seen so far. That said, the government and its chief scientists and doctors say that really at this point in the outbreak that is to be expected, and they are not saying that they are seeing a jump in the fatalities at the moment that is an unexpected jump. And they also say that in terms of the lockdown that has been in place here in the UK for just over a week now, that you won't see the full effects of that in the numbers with regards to cases but also fatalities for another week or so at least. So the jump in deaths doesn't necessarily mean that the lockdown measures currently in place aren't working. We should see the effect of that coming through the trajectory of the outbreak in the not too distant future. But certainly real concern in the UK about where the trajectory is headed. British officials do currently believe that we are headed in a similar direction to perhaps France, which we are some way behind. The real hope is that the curve here in the UK won't take off in quite the way that we have seen in Spain and Italy. But certainly the government insisting that the timing of the measures it's put in place are crucial. The government also says it has data already which shows the vast majority of Britons are observing the restrictions, the guidelines, the advice in place with regards to safe distancing at the moment, and they believe that that will feed through into the numbers in the not too distant future. They do believe it's having an effect.
All right, Ollie, stay safe over there. Ollie Barrett there in London.